How much does keyhole heart surgery really cost in the United Kingdom? Hello, I'm Inder Birdi, consultant cardiac surgeon and founder of the Keyhole Heart Clinic here in London. This video is for educational purposes only, but it will hopefully help you understand the realities of how heart surgery is costed up, particularly if you're considering your options outside of the National Health Service. Now, if you've been told you need heart surgery and you're wondering how much it's going to cost, you're not alone. It's one of the commonest questions my team get asked every single day. And I get it, it's a very important question. So in this video, I want to give you a really honest and transparent overview of the numbers, the reasons behind them, and how we approach this at the clinic. Let's start with what we mean by keyhole heart surgery, because after all, that's the most common reason people come to see us. Keyhole or minimally invasive heart surgery means we don't need to open the breastbone. Instead, we make a small incision, usually around 4 or 5 centimeters between the ribs. There's no broken bone, and this heals much more quickly. We use specialized, rather expensive instruments and cameras to repair or replace heart valves or to perform bypass grafts, including single, double, triple, and even quadruple. In order to assess one's suitability, we need to look at a number of different factors. Specific factors related to you, how healthy you are, what other problems that you've got, what the nature of your clinical condition is, how many valves might need to be repaired or replaced. Those are the things that we will use to make a preoperative assessment of your suitability. And if you're suitable, then everything's in place for us to deliver a keyhole heart surgery procedure, which will offer real benefits over traditional open heart surgery. Now let's talk about the cost. On the NHS, care is free at the point of delivery. That's fantastic. But not every NHS cardiac centre offers keyhole surgery. So if you're referred for traditional open heart surgery locally, it might not be because you're unsuitable for keyhole. It might simply be that it's not available locally. So you must ask. Now in the private sector, of course, you have more control over where your surgery is done, who performs your surgery, the approach used, and the timing. But of course that comes at a cost. So what are the actual numbers? At the clinic, we can perform keyhole, valve repair or replacements, aortic or mitral, and generally these costs range from about £40,000 to £45,000. Keyhole coronary bypass surgery is a bit more expensive. It can be £45,000 to £60,000. But of course these are just estimates. A lot of that cost comes from the hospital, the operating theatre, the ICU, the team that look after you, your bed stay and medications. And that's not something we as clinicians directly control, but we can give you a very clear idea once we've assessed your case. Preoperative assessment is important. That could include CT scans, echocardiograms, blood work and consultation fees. Much of that, if it's done already, we will be able to use and present to our multidisciplinary team. Then the hospital stay. Most keyhole patients stay between 3 to 5 days. Now that might include 1 day on ITU, 1 day on high dependency, and a few days on the ward. We generally estimate for 7 days to keep things top heavy. We'd rather overestimate than surprise our patients later if we can. Then there's the aftercare. That's often forgotten, but it's critical to get the best outcome. At our clinic, we've built that into a package so that you know exactly what's included from a clinical perspective, from the doctor's perspective, from consultation to MDT review to surgery to recovery. All of that's included out to 6 weeks in the cost that we offer. One of the things that is very, very transparent in our clinic is the cost of assessment. Now that cost includes the consultation, 45 minutes, presentation of the case to the MDT, and then a follow-up consultation to give you the overall view of the clinical team. So you can trust the opinion we give you. And you can take that wherever you wish. You can take it back to your NHS organisation or to another private centre. We don't mind. We want to help you on your journey. Now, if you decide to have your treatment with us, we will then ask the hospital to provide us with an accurate estimate of what the cost will be. And we will also have a good idea of what length of time you'll need to stay in hospital based upon your pre-existing clinical history and how well you are. For example, if you've got kidney problems, you're likely to stay in hospital longer. We can also offer fixed self-pay packages, and when we do that, the hospital will often charge a little bit more up front and then fix the cost. Alternatively, there are open costs which are a little cheaper, but of course if you do need to stay in hospital a bit longer, there will be added costs associated with that, and that can be a bit of surprise for some patients. Ultimately, though, it isn't just about financial figures. It's about value and what's important to you. For example, what might be the added value of faster recovery, of less pain, of being home with your family a week earlier, of avoiding a wound infection or bone not healing properly or a long ICU stay. We've had patients who choose keyhole surgery because they can return back to their work in a matter of weeks rather than months. For others, it's about preserving dignity, avoiding visible scars or reducing trauma. If you're having to borrow money for your care, you'll need to consider that too, the interest repayments, the timing, and that, of course, may influence your decision. And we're here to help you in deciding what is the best treatment for you then to decide where you want that treatment to occur. So in summary, the cost of keyhole heart surgery in the UK typically ranges from £40,000 to £60,000, depending upon the procedure and your individual needs. But behind the numbers are real considerations about timing, recovery, and quality of life. If you want a clear diagnosis, treatment plan, and a full breakdown of costs, we're happy to help. There's no pressure to proceed. Our role is to give you honest advice and support you in making the decision that's best for you. Thanks for watching. If you found this video helpful, please like, share, and subscribe. You could help someone else make better decisions about their ongoing heart care. Thank you.